Good afternoon, everybody. So, welcome to Skills for Med. And today is the third week of March. So, we'll be focusing on learning from errors and incident reports. And today's topic is going to be on preventing fall injuries. And this will be an interactive discussion between Dr. Parivalvan Rajavelu. He's consultant surgeon, Sundara Medical Foundation, and he is our founder for Skills for Med. And for the new people who have logged in for this webinar, I would like to say about sir, he is a great orator, he is a quality professional, and his keen focus is to upskill the nurses and to empower them. It's just not the nurses has to be on the bedside, they have to empower themselves to uplift the healthcare activities. And I myself will be with the discussion with Dr. Pari. I'm Stella Townsend. I am the training manager for the Skills for Med. Today's topic is about understanding falls in healthcare, preventing fall injuries. So before that, we would like to show the quick introduction. Everybody knows like what is fall and what is fall related injuries. That is actually common thing which happens in the hospital, but which we won't like it to be happening like when we are on duty, or mostly when patient comes for specific treatment, they go back with another multiple treatment due to fall, which is really is going to cause the damage to the hospital reputation and also about your quality. And most of the falls can be prevented by doing the proper risk assessment and adopting the appropriate prevention strategies. So accurate reporting and prevention strategies can save lives and improve patient safety. An impact of falls in healthcare is actually second leading cause of accidental injury deaths globally, which is announced by WHO. So they say like 1 in 4 hospitalized patients aged above 65 plus, which they come under the vulnerable group. So they are like proposed for the fall at least once. So we have to do the early intervention in these age group people, and proper incident reporting will improve the patient outcome. Unless otherwise we report the incident to the management is not going to see the underlying cause for the fall, what is the real reason for the fall. And if we do this early intervention and proper incident reporting, we could even prevent the future falls in our organization. And there are consequences of fall, of course. That is like you can see for the both aspect. Fall is not only going to cause impact for the patient, it is also going to impact the organization, which I've already mentioned. Like for the patient, physically they're going to have damage, like they're going to have the fracture, head injury, which is so lethal, and prolonged recovery is going to be happen. Depending on the age, it may even go worse. And psychological effect, it's like fear of falling and reduced mobility. So moment if it's a if it is a geriatric patient, they're not going to step out of the bed if they have faced one's fall. And for the organization, legal and ethical implications would occur. And common reasons for fall is like not doing the fall risk assessment properly. We might have the fall risk assessment, but we are not doing it as a checklist. Instead, we are using as a tick list. There goes some issue. And not implementing the fall prevention plan and communicating fall risk to the care team. You know that particular room number patient is having a high risk for the fall, and you have to communicate during your handover. That patient has to be monitored hourly once or 2 hourly once based on your organization policy, how you are doing it, and you have to fix up that the patient is taken care well. And using appropriate fall prevention aids is another important factor. You have to do the fall prevention risk assessment properly, and you have to provide the fall prevention aids for the patient, and reassessing the patient risk and understanding. And here comes the scenario. There is an 80-year-old male patient suffering from dementia, and patient have admitted to the ward, and nurse conducted the preliminary assessment and oriented him to his room and explained how to use a walker. So this complete thing has been done to the patient by the nurse. So before departing, before leaving the patient room, she advised to the patient that call if any assistance is required. And during the shift round, the patient was discovered lying on the bathroom floor. And when asked, he mentioned that he tried to use the toilet independently, even though the walker was within the reach, because the nurse has already explained. But no, he have urged to the washroom, so there he have had a fall. And nurse completes an incident report. So here the incident report, how the nurse have stated this. I think everybody remember, the previous participants are there. You will be remembering how the incident report has to be written. So we'll have the same here. Like you are going to contribute. First we'll have the nurse. What she have written is like an 80-year-old male patient was found lying on the bathroom. Like bathroom floor after attempting to use the toilet alone despite having a walker, and when and where. For that she's answering like during shift round in the patient's bathroom, and immediate action taken, that was stated as stabilize the patient. And contributing factors for that, the nurse have explained like patient attempted to use the toilet alone despite prior instruction, and recommendation for improvement, the patient should be more careful and always call for assistance. So these are the things she have stated in the incident report. And now I would know, you can raise your hand and you can start saying in each phase what all the incident wrongly have been reported here.
Can you click on the presentation again?
Yes, sir.
Yeah, I think we're going to pause here and make it a little bit more interactive. So people who want to add in the comments can do that. Or if you're not shy, you
Yeah.
can raise your hand and we'll allow you to unmute for you to talk. So we'll have just 5 minutes for this session, because I think we did talk about how to write an incident report last time. So it'll be good to know how much of that actually stuck since last week.
Yeah. Portia Priyadarshini have raised a hand.
Okay.
Enable her to speak.
Yeah.
Okay. Portia? Portia, you can unmute yourself and you can you can say what went wrong in this incident report.
Okay, can you unmute the next?
Yes. Sir. Same. I can see Portia again. Jyoti is unmuted now. Jyoti? Shreya? Shreya?
Yes, ma'am.
I think is this Portia?
Yes, ma'am.
Yeah, Portia, please proceed.
Ma'am, we should have checked whether there is any wet floor in the toilet. That we could have prevented that.
Okay. The question is like you can you have to say like what is wrong in this incident report. You
Uh,
can find the mistakes from the incident report what the nurse have written here.
We're not talking about root cause analysis here. We're only asking whether this incident report is written correctly, or do you find that it could be written better? Okay, what about
Can you hear me now, ma'am?
Yeah, I can hear you.
When it comes to 80 years old male, they would have given patient is high risk. Education on patient is high risk, and without attendant, they should not go to the washroom, or without attendant or assistance, the patient should not get out of the bed.
okay,
To the family and also patient.
fine. Again, you're talking
I think
about
again, yeah.
the cause of, you're trying to find out the cause. See, this is very actually natural, and which I find in many incident reports. Before writing an accurate incident report, we jump into finding out the causes. What we are trying to emphasize here is how to write a good incident report. And we want you to look at this incident report and tell, okay, incident report is, I'll give 100 out of 100, or you think something else, can be written here.
Actually, sir, in this particular incident report, the chronology of the events is not mentioned. We need to write the date and time when the fall has happened, whether it has happened early in the morning or what time of the day. To identify that could be one of the cause. Was the patient alone while going to the bathroom? That is also was not mentioned.
Very good. I think this is
Yes.
what, no, this is the Sherlock Holmes in action, finding out what is wrong in this report. Yeah, that's fantastic.
So
Uh,
date and time of the fall,
anything else?
and
Anything
plus
else you can make it better, this incident report?
we need to find out whether the patient was present with someone.
Yeah, anybody accompanied the patient? Yes,
Yes.
Yes.
that is not there. Not accompanied or
It is not
accompanied?
written.
Not
Yeah,
mentioned.
yeah.
Yeah.
Okay.
And we just last few questions because almost not
Yes,
one
sir.
left. So Jyoti, you can unmute.
Jyoti, she
Yes.
answered just now, sir.
Yeah,
She
she
answered.
answered. Okay.
Yeah,
Yeah.
yeah.
Anita.
Anita, Anita, you can unmute yourself and then you can answer if you have anything here to contribute with.
Yes, ma'am. In this report, they have mentioned that he was found lying in the bathroom. They could have mentioned like it is unidentical position. We don't know if he was lying down or he slipped and fall. So that
Okay.
could have been mentioned.
Mechanism is not
Okay.
written.
Yes.
Okay.
Okay. Understood. Clear.
That's good. Yeah.
Yes.
All
So,
right.
shall we proceed with the next slide, sir?
Yeah.
So, here comes. So, what happened? So, in that, the lacks clarity and detail. So, it didn't include what is the cause of the fall, whether the patient tripped or lost balance while he was walking, and the documentation of any sustained injuries was not mentioned. So, in what happened, that is very important. It is not just saying what she saw, and she has to say what is actually the clarity and detail is lacking here. And when and where, I think ma'am have explained about the critical details, date and time and exact location. That is very important. Patient bathroom is just a plain statement. They should say in which location, which ward, which room, where. So those things are very important, and date and time, that is crucial. And immediate action taken, in that what the nurse have said is stabilize the patient. So doesn't specify the type of injury or the steps taken. So immediate step, stabilize the patient. How? So what is the injury? Whether the dressing done or the bleeding occurred, what all things, what type of injury, cut injury, or what happened to the patient, that is important. And contributing factors, the nurse have stated here, is patient attempted to use the toilet alone despite prior instruction. This is lacks the objectivity, does not explore possible system. It is like, patient medical condition is not, no, patient is dementia, and that is not mentioned, and inadequate supervision is not mentioned, and unclear communication and environmental hazards. Those all, these four important parameters have not been mentioned here. And recommendation for improvement is like, patient should be more careful and always call for assistance. That is almost like, so called the blaming culture. That is unfair. So patient is already a dementia patient, so uses blame instead of focusing on system improvement. So that could be done better rather doing this. These are the things where no clarities were missing out in this instant report. So here, so how to write an instant report? So for the benefit of newcomers, sir, last time we had a lot of suggestions and feedback from all the nurses who have attended. They have gotten great impact and great benefit out of this instant reporting format. So we would like to share the video again so that they will get a clarity how to write the instant report in a right manner.
So you rather see the video than listen to me, right?
Sure, sir.
Okay, go ahead. Go ahead.
Yes.
Right. How to write the incident report is very important, and most often I find that we often sit in the room and write the whole incident report, or maybe call the people from the where the incident happened and try and write the incident report. But in the Japanese terminology, there is a thing called go to the gemba. I think the video is not syncing, no? So unless you actually go
Okay.
where the incident is happening, can you just pause the video?
Yes, sir.
Yeah, I think better I just explain it. Can you just move the mute the video?
Sure, sir. Mute the
Move the slides. Yeah.
audio. No? Yes, sir. Done.
Yeah. So, what what is the most important thing is actually to go to the 1 minute.
Yes, sir.
Can you just come out of the presentation?
So you want me to stop sharing?
No. Presentation mode. Come out of the presentation mode. Yeah, you can stop sharing for the time being. No, come out of the presentation mode first.
Is that okay, sir?
Yeah, now you can actually click on the video
Okay.
and go to the video settings on top and crop my video out of it. The video settings on top. When you click on the video, there is a video playback and then video settings, right? On top.
Just a moment, sir. Yeah.
Yeah, click on the video. Yeah, click on the video.
Yeah.
No, not this. No. The presentation. Okay, you just unshare. I'll share the video.
Yeah, sure, sir. Thank you.
Like this.
Okay, I'm sorry about that. Are you able to see the video?
Yes, sir. Now I can see the video.
And 1 minute. Okay. All right. So the first point to be made is that you should not. Are you able to hear me?
Yes, sir.
Are you able to hear what I'm saying?
Yes, sir.
Yes, sir.
Yes, sir. Yes, sir. I will listen.
You're able to hear me, right?
Yes, sir. You can proceed, sir. We are able to hear you.
All right. So the point I want to make is that you don't sit in the room and do the incident report, but actually you have to go to where the incident happened. So that in the Japanese is called the Gemba walk, where you first go do a thorough observation, recognize what has happened, and most important is to communicate with the people who were actually at the incident site and ask what happened, get a detailed report on that. And then whatever is required, don't go with a confrontational attitude. You need to go with the cooperation attitude, and unless you do that, others will not cooperate and tell you what happened. Okay, so you need to be very go in a cooperative attitude, and the whole thing is to solve the problem, not to find fault or anything like that. So that is very, very important. Okay, so you've got to ask these questions. Where did the incident happen? Okay, write down the exact place, date and time of the incident. And the next you got to see what happened. As I said, ask those who saw to explain it in simple, clear words and note down what happened. So that's very, very important. And why did it happen? So look at the area, equipment, surroundings. Maybe the floor was slippery, as somebody pointed out, or there were objects on the way that the patient could have tripped. So all these things have to be looked at. And then how was the task being done? So here we're talking about a fall, but many times it may be other instances. For example, if you have a equipment falling down and breaking, then how was the task involved? Did they take the proper precautions? Okay, so this is also important, how the task was being done. And here, the task was being done without supervision. So that is what you have to note here. That is the reason the patient had a fall. And then, did the patient have any harm or injury? And write down if someone else was hurt or if anything was damaged. So even if it is in equipment, it's still important. And that is why the harm not only includes humans but also the machines. And how did the people respond? What was the immediate response? So what actions were taken, like first aid or calling for help? So this is also very, very important. Okay, so in summary, where and when did it happen? Who was involved? What happened? Why did it happen? How was the task done? What harm or injury happened? And how did the people respond? So all these things should be in the incident report. So as I told, one of the things which we forget is to write a proper incident report. So instead of that, we just keep talking about what is the cause. You immediately go into finding out the cause for the incident. No, otherwise it would be incident report and root cause analysis report, right? So the root cause analysis has to be done in a multidisciplinary manner. We will talk about this a little bit later. But the incident report is a very detailed report which catches all the point of the incident, and that is when you will be able to really find out the root cause of the incident. So that's what I wanted to say. So let us go to the next slide. Okay. You carry on, Stella.
Yeah, yes, sir. So there is approach to the problem. So I'll share.
I've given the mouse control to you also. You can also use it.
Okay, thank you so much, sir. So there is approach to the problem. So always define the problem using a systematic approach. So that, always define the problem. Like problem identification must be done first, and then you have to identify what exactly happened, and then you have to form the team where the all the required people have to be there in the meeting, so that you have to do the proper brainstorming. And third one, you have to identify the possible and probable causes. You should identify the root cause analysis based on the causes what you have identified, and then you have to derive the corrective and preventive action. And sixth is that you have to do the action plan and follow up. So for all those things, action plan, I think you all will be remember previously we were saying what is the least thing which you can be done first. You have to prioritize that first, and the major task which consumes time will be put to the last. So you have to plan accordingly. And there is a steps in brainstorming, because we would say like brainstorming is very important. So that steps, if you follow all these steps, then it will be effective brainstorming, and you can find out the actual root cause. And define the problem is like identify when and where the patient fall commonly occurs. So that gives an idea where in the organization majorly if the fall is happening. For example, if it is in the 5th floor, the particular room number, then there you will have a keen focus, and the organization will take certain steps to resolve that. And set the ground rules. Always in the brainstorming, it's very important. You should not be very judgmental when they're giving any point, and don't criticize the ideas. Even that idea is not going to support your activity, that is okay. Encourage the point. Might be later they might even give you the valuable points. So always don't be judgmental, and encourage everyone to participate. Don't keep anyone, or you don't point out someone, you say the point like that. You allow everybody to talk, and then focus on listing scenarios before prioritizing. And generate ideas. It's like ask participant to suggest fall injury scenarios. What all scenarios are possible, they can talk it out. And for generate idea, you can use the sticky notes or the whiteboards, because as the participants start to say one scenario and the ideas, you can start writing out on the sticky notes or on the whiteboard, or you might even use the digital tool. So possible scenarios, what they might be saying, like during transfer, the falls occurring, or attempting to get down to the side rail gap, which usually patient are very interesting. We are putting the side rail up, the patient will have a fall. No wonder they will be trying to get down through the side rail gap, rushing to the washroom without assistance, reaching out for the call bell while repositioning in bed or chair. Might be these are the possible scenario participants are giving. Write down in the sticky note or the whiteboard what I was earlier mentioning. And after defining the problem, after getting the ideas, and then you have to categorize and refine them, because you have 30 to or 20 or 30 participants in the group of brainstorming. There might be 4 or 5 ideas would be similar, so you can group them into one response and identify the frequent or high risk scenarios. Which scenario have come most participant have said, that will be like categorizing as a high priority. And then evaluate and develop. So you have to discuss critical risk points once you have analyzed the responses, and then you have to brainstorm the safety measures and prioritize the actionable prevention step. This is what I was saying. So while while figuring out the actionable step, you have to prioritize which you can be done first and which you can be done last. And the RCA tool, it's a 5-way. Yes, sir. So we have come to the root cause analysis, the 5-way analysis. Now Dr. Pari will be taking over.
Okay, thank you, Stella. I think, it's a very detailed thing of how to do the go about the problem. I think last month, I think we looked at the fishbone or the Ishikara way of doing it. Fishbone is what everybody talks about. But today we wanted to focus on the 5-why analysis. So these are all tools which which we use for root cause analysis. And 5-why is a very simple but effective tool, and we thought we will look into this here. So how do we do the 5-why analysis? We have to get a team together, as Stella already pointed out, define the problem. And the most important thing is to ask why. But I would say the most important thing, more than asking why, is to learn when to stop. Though it is called the 5-why analysis, you can keep on asking why. There is no end to it. So that is why people have said 5-why analysis, so that at least you stop at 5. But it is no hard and fast rule. No, you can actually maybe ask one more question more or one question less. It doesn't matter. It is also known as a 2-year-old method. If any of you have got a 2-year-old, you will understand it, right? So they keep on asking why. Okay, so that is why this 5-why method is also known as a 2-year-old method. And the answer to the first why will lead to the second why. So let's look at some examples. So here is overall thing of how the 5-why is done. So the problem to be addressed, this patient had got a fall is the problem. And you ask why did the problem arise, and you keep asking why till you find the root cause. So the objective is to keep on probing until the genuine root cause has to be identified. So it's very, very important to find the genuine root cause, and that fewer or more whys may be appropriate. So that's what I said. You don't need to exactly say 5 whys. Sometimes you can find it out in 3 whys. Sometimes it may take 7 whys also. So that doesn't matter as long as you get to the root of the problem. That is the most important thing. So there is many times now we get into the what is known as the wrong rabbit hole. Now the rabbit, when it is being chased, if it gets into the wrong rabbit hole, it will get caught, right? Similarly, now if we get into the wrong why, then you will be distracted into something else. So how do we know that actually that why we ask is the answer for the exact answer for that particular problem? So there is a way to do it where you ask therefore. Let me explain it with a very fun root cause analysis. So here is a problem statement. The king lost the war and he lost his kingdom, and so they all ran to the forest. So they were all very quality-oriented people, even at those times. So the king and the minister all sat together and started doing a 5-why analysis. So they started asking, why did we we lost the war and it cost us a kingdom. So why was the war lost? So the war was lost because the battle was lost. There is one particular battle which was very crucial and they lost it. Why? Because the rider carrying the intelligence was lost. That particular enemy was coming from that side. They didn't get the intelligence because the rider could not come there. So why was the rider lost? Because his horse threw a shoe. The horse, they put the shoes, the metal shoes. So one of them became loose and therefore the horse could not run and therefore the rider could not come. So why did the horse lose its shoe? Because it was not attached with enough nails. And why was it not attached? Because the blacksmith did not have enough nails to attach the shoe properly. So the root cause was shortage of horseshoe nails cost us the kingdom. So, that is how the 5-way analysis was done. So that, and the root cause analysis. But now, if you want to find out whether you really have done a proper 5-way analysis, you have to ask therefore. As you can see here, here you ask, blacksmith did not have enough nails to attach each shoe properly, therefore, the shoe was not attached. Therefore, the horse threw a shoe. Therefore, the rider could not reach in time. Therefore, the battle was lost, and therefore the kingdom was lost. So this is properly and very logically leading to the problem statement. So you may ask many whys, but if you have a doubt whether you are going the wrong direction, see whether you can ask therefore and trace back without any loss of logic to the problem statement. This is a very, very important quality control tool you have to use in 5-way analysis. So this is why something which will tell you that you are doing the 5-way analysis correctly. Okay, so that's how you go through the whole thing and ask therefore for each step. Okay, so here let us look at this problem statement. Unassisted patient mobilization leading to a fall because of despite prior instructions on using the walker. So this is the problem stated. So even though you said use the walker, the patient went unassisted and therefore had a fall. Okay, so why? The patient was found lying in the bathroom floor. Why was the patient lying on the bathroom floor? He attempted to walk to the toilet despite having a walker. So why did he not use the walker? Because he forgot to use the walker because he had dementia. So this is very, very important. Okay, if it's a normal patient, then you can say I've educated him. But here is a patient with dementia. Even if you educate him, he may forget. So he forgot because he had dementia, and his cognitive impairment affected his judgment to follow, the ability to follow instruction. You had given instructions, but he did not have the ability to follow instructions. So that is the next why. And then why was this not happened? Because fall prevention strategies, especially for cognitively impaired patients, was not implemented. And why was this not implemented? It is not there. We don't have any separate instructions for cognitively important patients. So this is the root cause. Okay. So now you ask, therefore, you can say there is lack of SOPs for cognitively impaired patients. Therefore, they were not implemented. And because it is not implemented, the patient did not follow the instructions, or you didn't put enough safeguards that knowing that the patient cannot follow instructions was not put in, and therefore the patient did not use the walker, or and therefore the patient went to the toilet even in spite of having the walker, and therefore he fell down. You see how this can be done? So let's see the whole 5-way analysis all over again, but you went to the wrong rabbit hole. Okay. So the same thing, patient was found lying in the bathroom floor. The first incident report, remember, where we criticized. He attempted to use the toilet despite using a walker. Why? He forgot to use the walker. And why? Patient was not educated. Why? Nurse failed to educate the patient. This is usually the root cause which is said, and the corrective action will be train the nurses to educate the patient. This is a very superficial root cause analysis, because you'll see the fallacy here. Nurse failed to educate the patient, so patient was not educated. Because the patient was not educated, he forgot to use the walker. Is that true? No. Patient forgot to use the walker because he had dementia, not because he was not educated. So there you can see that this is not the correct root cause analysis. Okay, so this is how you use the therefore to make sure that you are. I think the spelling mistake here, it is a wrong rabbit hole. I think Vidya said she is going to correct the spelling mistake, but still it has come. I don't know how it's come. So we need to find a root cause analysis of why spelling mistakes happen in our presentations. Okay, right. So the root cause was lack of fall prevention strategies in the hospital for cognitively impaired patients. So that is the root cause analysis. And the corrective action will be to develop a structured root cause and safety interventions for especially for cognitively impaired patients. You may have it for all patients, but do you have fall prevention strategies for cognitively impaired patients? Because you are dealing with a lot of elderly patients nowadays. So that is a root cause analysis. So then a little bit about immediate correction. So you ensure safety first and your safety first, then you assess the patient, then you call for assistance and provide first aid. Do not move immediately. Sometimes, the patient may have, even a cervical injury. So make sure it is safe to move the patient and then move the patient, report the incident, but keep monitoring the patient for any delayed symptoms. So this will be the immediate correction of any fall injury. Now let's get into corrective and preventive action. As we have explained last time, I hope you remember that tap and bucket example I gave. Corrective actions are fixing the problem by identifying and eliminating the root cause. Whereas preventive action is preventing its recurrence in any part of the hospital, not only in the ward it happened, by making systemic improvements all over the hospital. So that is preventive action. Okay. So here corrective action is you need to develop your standard operative protocol for cognitively impaired patients, then train the staff on new patients, maybe pilot it in the ward where the problem happened. If there's any corrections, make the corrections, standardize the SOP. Now you get into preventive action, where you standardize. This standardized SOP is used to implement this particular protocol all over the hospital. You need to do frequent audits to make sure that this is happening properly, and also ensure to make sure that you have a safe environment like handrails, proper lighting, etc. Okay. So a small quick note on preparing the SOP. I think this is something which all of you may be familiar, but we thought we'll just quickly touch upon that. So how do you prepare this report? So first of all, you need to identify who's the target audience. When you prepare any SOP for that matter, first you write who's your target audience. Here it is nursing staff, caregivers, and healthcare providers who have direct touch with the patient. And then you list all the risk factors which came up in your discussion, brainstorming, that is particularly relevant for cognitively impaired patients. Impaired judgment, reduced ability to recognize hazards, gait and balance disturbances, effect of medications, agitations, wandering, impulsive behaviors, visual defects, and maybe spatial, they're not able to find out the orientation in the room, and poor communication abilities. You're not able to communicate with them properly. So these are all risk factors specific to the cognitively impaired patients. You take that into account before writing into your SOP. And then you divide that into patient assessment, environmental modifications, supervision. Somebody pointed out that this patient had to be supervised. So when do you, institute supervision assistance? How do you do it? Use of assistive devices and technologies, like bed alarm and things like that. Behavioral and cognitive interventions, medication review. Make sure you rationalize the prescription to make sure you minimize the fall risk. And then how do you do your post-fall response and reporting? So that is how a full SOP should be. So after the SOP is written, then use the SOP to prepare your training material and do a training for all the staff. You can have hands-on simulation, you can have refresher courses, and also about the medication side effects. Okay, then you put a monitoring system in place and conduct routine safety audits. and regularly review your fall prevention policies at least once a year. And do a very methodical family education and patient education, especially family education for cognitively impaired patients. And make sure that all your staff comply with this newly implemented SOP. Okay, so with all that, you could now put a fall prevention program. Okay, so it is very, very important that every hospital has got a fall prevention program. See, the whole thing about incident reporting is improvement. So with a single incident, you should make a systemic improvement across your whole hospital so that a fall does not happen in your hospital. And for that, we need a fall prevention program for the whole hospital. And that is the ultimate aim of incident reporting, root cause analysis, and CAPA. So when you talk about any prevention program, any risk prevention program, you could do it by eliminating the hazard, putting in engineering controls, administrative controls, work practice controls, and personal protective equipment. So this is how you put your fall injury prevention program. So elimination of hazard is avoiding wet floors, trip hazards like objects, adequate lighting. So all these things are elimination of hazard. The second is engineering controls. Install grab bars, handrails, non-slip flooring. Give the patient non-slip footwear. Secure the wheelchairs, stretchers, and beds with lockable wheels so that they don't fall down during transfers. So these are some examples of engineering controls. And what are administrative controls? This is putting a hospital-wide fall prevention policy and training, conducting risk assessments using validated tools like Morse, fall risk scale and things like that, and assign fall risk identification, putting those wristbands for patients so that you can identify who's at risk. Then there are certain work practice controls. So what will the healthcare workers have to do while dealing with such patients who are at risk, like mobility assistants, like walkers, scheduled rounding, call buttons, beds, alarms. Now, when patients comes off the floor, like our regular cars seat belts nowadays, when the passenger sits on it only, it will alarm. If there is no passenger on the seat, it will not alarm. A similar mechanism you can put on the patient bed. Whenever the patient is off the bed, then the alarm will go off. So that will tell you the patient has fallen down. Okay, then there are certain personal protective equipment. We talked about non-slip socks and shoes, and also hip protectors. Okay, you can give them hip protectors, even then fall, that bone, the neck of femur does not directly impact and get fractured. So these are some personal protective equipment you can give to the patient. So I would leave you to summarize this presentation, Stella, and I think we'll come to the end of this presentation.
No, the next thing is not coming up. It's not populating. Yes. So we have come to an end. The document incident clearly. It is very important. Always when you document, so when you find the incident, you should know how to write the incident clearly. You cannot be don't rush up in writing the incident, I would say. So you take some time, not 2 days of time. You sit calm, and then Gemba, you have to go to that incident site and then analyze it and write it properly. You should include all the key details, and then you have to do analyzation using the root cause, and that is like 5-way analysis. I think today you would have got a great idea about 5-way analysis. Actually, sir, last webinar there was a question, can you please explain more on 5-way analysis? So that have been done today. And next thing, you have to take the immediate action, because how it is very important to write the documentation, incident reporting, that far important is like prioritizing the patient stabilization. You have to assess the injury and then you have to implement it, and then prevent future risk, educate patient and implement preventive measures, and promote the safety culture, train staff, and you have to reinforce the protocol. As sir said, yearly once at least you have to review your protocol and then you have to reinforce it, and ensure a hazard-free environment. And fall injuries, as firstly we have mentioned, that is like all are preventable, and you have to adhere to the safety protocol and the best practices to prevent the fall injuries.
So thank you so much, everyone.
Thank you so much.